Thank you for joining me today. Please prescribe. In this video, we are going to talk about panic disorder emergency, rapid stabilization of a severe respiratory distress, and psychosomatic crisis. And we are going to learn more about differentiate panic attack from life-threatening cardiopulmonary, neurotropic, metabolic, toxicology emergency, perform a rapid assessment of a patient presenting with severe respiratory distress and panic. We want to recognize aromatic, respiratory, cardiac, neurological, psychosomatic manifestation of the panic attack. We want to learn how to implement evidence-based stabilization strategy, use a trauma-informed communication and support interventions. We want to select appropriate pharmacology and psychotherapy treatment for acute panic attack and long-term panic disorder management. We want to identify the indication for emergency and referral, hospitalization, specific consultation. When develop individualized relapse prevention and patient education plan. We want to apply a current clinical practice guideline for panic disorder across the emergency and outpatient setting. So, panic disorder is characterized by recurrently unexpected panic attack combined by persistent concern about the future attacks or maladaptive behavior changes. Although panic attacks are not inherently life-threatening, there are presentations often closely resemble a medical emergency, such as stroke, such as cardiac infarction, like pulmonary embolism, they mimic that, asthma attack, cardiac rhythm, low blood sugar, stroke, all this have symptoms that mimic panic attack. So patients frequently presented to the emergency department reporting sudden inability to breathe. I can't breathe, I can't breathe, I can't breathe. That's what they complain about. I am having a chest pain. They having a heart palpitation, dizziness, fear of dying, fear of losing control or suffocation. That is the symptoms they will report. Because of the mistrued medical emergency can have catastrophic consequences. Clinicians must initiate appropriate every patient with chest pain and respiratory distress as a potential medical emergency until conditions have been resolved. For clinicians, effective management requires balancing quick recognition of a panic disorder with carefully exclusive of acute medical illness, followed by rapid symptom stabilization. patient reassurance, and initiation of a long-term evidence-based treatment. Panic attack disorder affect approximately 2 to 5 adults during their life. Most common develop between teenagers and early adulthood. Women are diagnosed more than men. Neurobiological of the panic disorder. Panic disorder results from dysregulation of neurotransmitters, fear center, aromatic activation, and respiratory sensory. Also, amygdala is hyperactivated. Fear, threat, emotional dysregulation, loss of control, tachycardia, tremor, hypervigilance, all that can happen in panic attack, anxiety, panic, sensation, respiratory hyperventilation, air hunger, dyspnea. It can cause all that. Panic attack can cause all that. It can cause heart palpitation, sweat, short of breath, feeling of choking, chest pain, nausea, dizziness, chill, headache. All these are the symptoms of panic attack. It affects the cardiac, respiratory, neurological, GI, psychiatric. It has all the symptoms. Cardiac emergency include acute coronary syndrome, cardiac rhythm changes, pulmonary emergency include pulmonary embolism, asthma attack, pneumonia, stroke, seizure. Low blood sugar is also hyperthyroidism, electrolytes abnormality. All these are emergency. Toxicology causes include cocaine intoxication, amphetamine intoxication, caffeine intoxication, alcohol withdrawal, sedation withdrawal. Initiate emergency assessment of the airway, breathing, and circulation. Focus on the history of the symptoms. You want to provide evidence-based psychotherapy, cognitive behavior therapy, mindfulness, acceptance-based therapy, and if it's indicated, you want to hospitalize the patient. You want to educate the patient about the symptoms and the treatment. You want to have relapse prevention strategy. Thank you for joining me today.